We know that for many women, having a yearly mammogram may seem like an unpleasant task. To walk us through this is Miranda Parson, a mammography technologist at ThedaCare Regional Medical Center. Nina, Miranda, thanks for being with us.
Thanks for having me.
Okay, so we are going to play a game of myth versus fact. We're going to talk through some of the misconceptions that women may have when it comes to having a mammogram. So we'll give you this board.
Thank you.
And ask you some questions to get us started. Okay, the very first one is that any woman can benefit from having a 3D mammogram.
Yes, and that is a fact. Any of our patients getting a mammogram would benefit from having a 3D mammogram. So the 3D mammograms do have an increased cancer detection rate, and they take clearer pictures. So it's really beneficial for patients, especially with denser breast tissue.
Our next statement is that mammograms are painful.
I'm going to say myth. They should be uncomfortable, but not painful. So what I tell patients usually when they come in for their first mammogram is it should be uncomfortable, but not unbearable, but tell me when to stop with compression. And the pictures are very quick. They range from usually but 4 to 7 seconds, I would say.
Oh, okay.
It's a quick process.
So maybe uncomfortable for just a small amount of time.
Exactly.
Okay. So next statement here is that you should tell your technologist in advance if you have breast implants.
That is a fact. Yes. So at the beginning of each exam, we do ask patients for their medical history, and we go over their surgical history as well. If they've had any breast or chest surgeries, we do encourage them to let us know. It does change the exam slightly. Patients with breast implants do have exams that take just a little bit longer because we're doing some extra pictures to include all the breast tissue.
Okay. But again, you want the best possible screening that you can get.
Exactly. So the more information we can get about their history, the better the pictures.
Okay. The next one that we have here, something that might have been floating around, is that maybe mammograms cause cancer.
Correct. Myth. So mammograms do use a very low dose of radiation, but it is something the benefit of the mammogram outweighs the risk.
Okay. All right. Our next one here is that most insurance plans, something like Medicaid, Medicare, they cover screenings for a mammogram.
That is true. Medicare and Medicaid do cover screening mammograms, as well as a lot of other insurance companies. If the patient is unsure on if their specific insurance covers the 3D mammogram, we do encourage them to call before the exam just to verify.
Okay. And as we understand the importance of having a mammogram, what are some words of advice that you can give to women as they are getting themselves ready for it?
Sure. So we do ask that you don't wear deodorant day of if you can. We ask that you wear a 2-piece outfit. So our gowns are t-shirt gowns. They don't go all the way down. So you're only undressing from the top up, and we'll walk you through the whole thing and you'll be fine. We'll take good care of you. So if you're nervous, just let your technologist know and we'll work with you.
All right, Miranda, really good tips and explanations. So we really appreciate your time.
Thank you.